Alright, this next exercise is another core exercise which will help to also work on keeping your lordotic curve in a neutral position, which also means that your hips should be in a neutral position, i.e. not too forward or anterior tilted or backwards or posterior tilted. Now my left hand is slid under my lower back so that I have light pressure on my hand, but not enough that I'm stamping my hand. So I'm just making sure that I'm keeping that safe arch in my lower back. From here I'm going to keep my chin tucked or my eyes on the horizon. Try to imagine that there's an apple between your chin and your chest, so you're not too high, not too low, right here. Our knees are up. This is our first progression. We're just focusing on keeping the stomach nice and tight while not putting any more weight into my left hand. And we can just draw that navel in, focusing on tightening through the entire midsection as if bracing for a punch. Shoulders are relaxed away from the ears. From here, we're going to transition into our next progression, keeping everything engaged. We're going to slowly kick one leg straight out, again keeping that pressure on your left hand equal. Try not to push into your hand, keeping the stomach in, and as you can tell, I'm starting to shake a little bit because I don't do this often. Good, and then we're going to transition back and try the other side. And this side's a lot harder, shaking a lot more. It's either fatigue or my right hip flexor's a little weaker, probably the latter, or a mixture of both. And we're going to come back, shaking stopped a little bit. Good. So that's our first progression, going back and forth, left and right leg. Now finally, we're going to move to our next progression. We're going to go right arm up, left leg out, kicking the right arm back, holding this position. You can hold it for 15 seconds, you can hold it for a minute. Just focusing on keeping the stomach in nice and tight the whole time. Keeping that pressure on the left hand the same as when you started. From here, you can come back up. You can switch hands. If you feel like you can hold that arch, you don't have to keep that hand under there, and you can just go back and forth with the opposite sides, just focusing on holding the position. And believe me, if you do this for long enough, heart rate will go up, and things will start burning soon. Other progressions or options that you can challenge yourself with, you can push the head into the table to work on the neck erectors, which will help to keep the lordotic curve in your cervical spine. Again, keeping the arch in your lower back, tightening through the midsection the whole time. And you can go back and forth with this, taking your time, holding positions until muscles shake or cramp or spasm. And take a break.